One of the key skills that they will be testing during your medicine and dentistry interviews is your ability to demonstrate empathy. Now, this is such a key skill that I'm going to talk through exactly the kind of scenarios that come up, how you can really put yourself in that top 10% of applicants by demonstrating empathy in a way that just is very natural and just really shows that you are a caring kind of person that will go on to be a great doctor or dentist. So in this video, I'm going to give you the bare minimum knowledge that you need to have to make sure that you do well in this. Then I'm going to give you a 4-step approach for approaching any communication or empathy type situation. And then finally, I'm going to show you how you can get in that top 10% and get that cherry on top sort of marks to make sure that you stand out to convert that opportunity of an interview into an offer. So the very first thing that we need to know is the difference between empathy and sympathy. So empathy is the ability to understand and share the feelings of others, whereas sympathy is having feelings of pity and sorrow for somebody else's misfortune. When you get a scenario where somebody's had some bad news and you're there to console them, they are looking for a set of skills that you need to identify and try and demonstrate when you sit that station. So normally it's going to be a number of communication skills, empathy skills, the ability to handle when somebody is upset or angry, and then finally your ability to seek support when it's appropriate, so escalate to a senior and know when it's the right time to do that, which we'll discuss later in this video. So now we're going to talk about the 4 steps that you need to do when tackling these scenarios so that you can really stand out. The first one is introduction. Now if you haven't seen it already, in this video here where I talk about teaching and explanation, I do a long bit about introduction, exactly how you need to nail it and the kind of elements of a good introduction that will really set the tone for the scenario and basically put you on the right path towards getting good marks. But it's always important to start the scenario really strong with a really good introduction. So a way to start the scenario would be something along the lines of, "Hi, my name's Ashley and Dr. Smith has asked me to come over and talk to you. They said you're a little bit concerned about so-and-so. Would you mind if we just had a quick chat and maybe I can help alleviate some of your fears?" So a good introduction involves saying who you are, what your role is, why you're there, and then getting the permission. So for example, in a scenario where a patient is maybe fearful about a procedure, you would go up and you would say, "Hello there, my name's Ashley, I'm a work experience student here. Dr. Smith has asked me to come and speak to you regarding some fears about the procedure that you're having tomorrow. Would it be okay if we had a little bit of a chat and maybe I can alleviate some of those fears?" And that would be a really strong introduction to do all of the tick boxes of your name, your role, getting consent and explaining why you're there. The second part is to explore the patient's concerns. So you literally ask an open-ended question, and we'll talk later about open versus closed questions, and just let them speak about what it is they're bothered about. The third step is that you listen, really listen to what they're saying, and then try and pick up on some of the little bits that they say that you might want to delve into further. So that is where we go from the open question in step 2 to the closed question, and we go specific about some of the things that they've said so that you can really nail down what it is. They might talk about a previous, in this scenario where we're talking about a fear of a procedure, they might have a fear of needles, and it might relate back to an old childhood problem. So just pick up on that to help them understand. And then maybe they'll give you something that means that they've misunderstood what the procedure is, and it might not involve needles at all, so you can alleviate their fears. It's really about asking those closed questions so that you can get the details to help you come to a solution with the patient. By that stage, you're ready to move on to step 4, which is you've basically come to a understanding of the crux of the problem, maybe even come up with some suggestions for how you can fix it. So essentially you wrap up the scenario by summarizing and coming up with an agreed plan, so to speak, of how you're going to move forward together and how you're going to help them. This might be you going to speak to someone, asking them to go and speak to somebody, or maybe you need to actually get them some help, which you'll talk about the steps to how you're going to arrange that. So let's go back and talk a little bit how we're going to nail the introduction. Firstly, you want to make sure that the vibe is right for when you go into the scenario. So that minute, I always say this, that minute of when they give you the brief of what the scenario is and you're orientating yourself to the context of the scenario, really think like, what is the vibe of this? Is it something that's really sad, or is it something where I just need to go and give some encouragement? So you want to go in with a a nice upbeat expression. You don't want to be too gloomy, you don't want to be too upbeat if it's a sad scenario, but you definitely don't want to go in gloomy. So just be slightly positive, slightly upbeat, but reasonably neutral. So think about your facial expression, think about your body language, even if you're online. If you are online, work out how you're going to translate that into from your normal body language to online. If you watch this video here, I'll tell you exactly how to do that. But just the main thing is to remain professional, face the patient, and then you're ready for your introduction. One thing I recommend is as you're entering the room, if you're there in person or even if it's online, just scan for any props that you might want to use. If you're going to be explaining something, you might want to maybe draw a diagram or use a prop that they have there to help with your explanation. And as I said, once you do all of those things, you're then ready to start your introduction, which includes your name and your position, why you're there, and then get permission to have a chat with them. So now we're going to zoom into step 2, which is to explore the issues. And this is all about your ability to build rapport with the patient. Now, what you want to do is to give them the space to answer the questions and just, like I say, asking open questions that are going to allow them to do that, but then don't pressure them into giving you an answer. The best way to build rapport is by doing the following 3 things, really. Number 1, as I said, is to ask open questions. So, what seems to be the matter? Is there anything I can help with? Those sorts of questions, just give them the space and let them kind of take it upon themselves to tell you what it is they're comfortable telling you while they're getting to know you a little bit more and building up trust. The next thing is you need to demonstrate empathy. Now, this is all about your tone of voice, your body language, how you sit, just everything about you. Now, if you really want to get into the nitty-gritty of what makes really good body language and demonstrates empathy and gets you those extra marks, check out this video here which talks about my online course where we go into a lot of depth, over 20 hours worth of videos just on this alone. The third one is active listening. So just demonstrate that you are paying attention, and it could be just a sympathetic when they say something, or just saying yes to acknowledge that you've understood. Or if it's a really tricky thing, just say, I can't imagine how that must be for you, or oh, I can't imagine how you're feeling. Whatever it is that comes naturally to you and doesn't sound too forced, that will really demonstrate that you're on their side and you're demonstrating that empathy in the way that they like to see. So if you can master those 3 things, you will have nailed the empathy and rapport building element of it, and you will get them to open up to you. And at that stage, they will give you some little things to cling on that you may want to go and dive in a little bit deeper when you go on to step 3. So before we dive into step 3, let's talk briefly about open and closed questions. Now, open questions by their very nature are broad. The patients will give longer answers, they'll be more detailed and usually quite personal. Invites people to give an opinion or a point of view. And usually the question will start with words such as maybe why, how, or what. Whereas closed questions, on the other hand, are very specific. They are usually answered with yes, no, or short answers. They are often confirmatory or asking more factual things. And then typically they'll start with a do, have, or will, and don't tend to generate an open conversation. They usually are kind of, as we say, short answers that will kind of get to the bottom of the thing that you're trying to narrow down. In these stations, one of the best ways to get the most out of the other person is to build rapport. Now, building rapport quickly is such an important skill that you must develop as a doctor. So here are some tips to try and help you do that. Some of the things that you want to consider when you're trying to build rapport are introductions, explaining why you're there and gaining their consent to talk. That is a really good way to start off on the right foot. Being relaxed yet being professional and having body language that reflects that. Using open questions so that the patient can talk and get relaxed and be comfortable in your presence. Active listening to show that you're with them and in support of them. Showing that you can relate to their point or that you'd maybe feel the same if you were in that situation. Making sure that you take your time and the patient doesn't feel rushed. And finally, being receptive to what they're saying. That means being attentive and picking up on those little details, which sometimes helps you get to the bottom of what's really bothering them. And then when they see that you're doing that, that's when they can see that you're really focused and there to help them, and that is the biggest thing that will build rapport. Step 3 is all about picking up on patient concerns. So what you might find during this station is that you kind of go back and forth between steps 2 and 3. So you might ask an open question in step 2, pick up on something, ask some questions about that concern, and then go back to an open question so they can carry on talking. Maybe they'll give you another concern, you'll explore that. So it's a bit of flitting between the two before you finally round off the scenario. So the stations will be there for you to pick up on people who are struggling, who are sad, maybe they're stressed or overwhelmed, and it's your ability to kind of explore that a little bit further. Now, the important thing to remember with this is that you need to work out when they give you a concern whether this is something that you are equipped to deal with. So if it is a medical thing that needs referral to the GP, or maybe somebody is seriously having some serious struggles that you're concerned for their safety, it's really important that you don't try and deal with that yourself. You recognize that you need to escalate it and you tell the patient that you're going to do so. We're going to talk about how to do that later in this video. So things that you should be on the lookout for to dig a little bit deeper into are things like cries for help, for example, or if they really give you some hints on something that they want you to dig deeper on. Make sure that you're matching your verbal and non-verbal responses in accordance with the situation. If it's sad, don't laugh, obviously. If it's something that you need to be sympathetic for, just be like, and just a tone of somebody who is caring for and being sympathetic to the sadness of the situation. Like we said before, allowing the patient space, and then also making sure to make little statements that show empathy. Things like, oh, you're doing really well, or gosh, I understand that this must be really difficult for you. The final and most important thing is that it's really important to withhold judgment. Just listen and be open and receptive to what they're saying, because if they feel that they're going to be judged, they won't open up to you and you won't get all the answers, all the information, which is important in real life, but for the station it means that you won't get the marks. So like I said, we need to talk about escalation. If you see anything or pick up on anything that the patient says that means that they may be in danger, you need to do what we call safety netting, and that is putting things in place to make sure that the patient will be okay. Now, when you get a scenario like that, you need to ask yourself, who do I need to help me resolve this situation? So it's usually going to be a senior or the GP or just somebody relative to the scenario that is the authority that you need to go to who can help escalate the situation to. So if we get to this stage, we're finally on stage 4, which is wrapping up the scenario. So here we should have identified and explored all of the situations, and now we're just going to do 3 things. Simply, we're going to arrange the next steps. So you are either going to arrange or go with the person to another place or person, or maybe you're going to trust them to go independently and you're going to point them in the direction of the person to go and speak to. And when you're creating your plan together, I want you to be aware of the following 6 points. Firstly, it's really important that both parties must agree to the plan. You have to do something that they think that they can do and they're happy with. It needs to be appropriate. Also needs to be realistic. You need to respect their confidentiality, and we'll talk about confidentiality in another video here, but for now you need to maintain their privacy and not say anything or disclose anything that they don't consent to. Make sure that you have a plan that is feasible and you're both happy with, and finally make sure that the patient's boundaries are respected. It must be something that they're comfortable doing. So to really stand out, like I say, probably the most important thing is to start with a really strong introduction. Then make sure you're asking open-ended questions to build rapport. Make sure you're making good use of verbal and non-verbal communications, showing sympathy in the way that you respond to any of their concerns with words or kind of sounds or whatever it is that shows a tonality of care and empathy. Fourth thing is to look out for any clues, whether they be verbal things that they say repeatedly or hints to show that they want you to explore something a bit further, or it could be clues around the room, maybe some cigarettes or whatever it is. Just be on the lookout for things that are there, that are put there for a reason. Then finally, make sure you always work within your limits. So if you get a situation that you can't handle or you think is above your station, make sure you escalate to the appropriate person. Now, if you want to find out exactly how to smash these interviews and just get in the top 10%, this video here is the ultimate resource. It's 20 hours worth of videos that are going to go into this in a lot more depth, plus all the hot topics, common subjects, everything that you need to make sure that you stand out. And if you want some one-on-one help to do some practice interviews and really make sure that your technique is where it needs to be, check out this video here. But otherwise, thanks for watching, and I will see you over in another video.